Welcome to Secular ACA. I'm Bill. In the last few videos, I talked about getting in touch with some of my deepest and most intense feelings. For example, the anger and pain my parents left me with after I became old enough to leave their house in Chicago and move to LA. I'm still amazed to see how those feelings drove my violent and destructive behavior as a child and as a teen. I was completely unaware of those feelings or motivations, even as they moved me. I thought I was just having fun and an exciting time, doing the things I like to do. Later in my 20s, when I began to become more aware of those feelings, I didn't know what to do about them. Fortunately, just becoming aware of my pain and anger enabled me to choose not to act on them. Instead of punching people for fun, I realized that I shouldn't be punching people at all. So I stopped engaging in the kind of antisocial behavior that I once did. In this video, I want to share about how I learned to rid myself of those and other undesirable feelings. In the process of doing that, I developed this pleasing sense of wholeness that I never thought was possible. In both secular and traditional ACA, this process of healing is called reparenting. That is one of the two most important concepts in the ACA program. The other top concept is that of the wounded inner child. Once you come to understand the meaning of these two concepts, the real problem is to learn to apply them to yourself. They have to be integrated into your self-understanding, and they have to be used every day if you want to rid yourself of the ill effects of childhood trauma. I learned to do that gradually, and I should say haltingly. While I understood the theory of reparenting my wounded inner child, taking the first steps towards applying that theory to myself was confusing and difficult. I just didn't understand how to do it. In the ACA literature, the advice to become your own loving parent is in the readings of every meeting. But if you don't know what a loving parent is, because you've never seen one, then how are you supposed to become one? I struggled with that dilemma for quite a while. Finally, I just said to myself, Bill, I love you. That was a lie, of course, but it was my first step. In fact, self-loathing was one of my major issues. As I mentioned, I think in another video, I had internalized what I saw as my parents' attitude towards me and multiplied it by 10. So when I finally started reparenting myself, self-hatred was one of my major challenges. One lesson I've learned from reparenting is that it's a process of rebuilding my relationship with myself. I had to develop the kind of relationship I wish I had had with my parents when I was growing up. I had to become my own ideal parent. So I imagined myself as a caring parent who would use reason, persuasion, patient explanation to nurture my inner child and to help heal its wounds. I had to make a deliberate effort at this. It didn't come naturally. What came naturally was to scold, berate, and shame myself. My relationship with myself before reparenting involved calling myself denigrating names like jerk or bum, or my dad's scatological terms that they're too hard for me to repeat even today. Reparenting required that I expand and deepen my self-awareness. This involved a lot of pain. I learned that the inner child wounds don't go away by themselves. They get buried or suppressed, but they stayed in me just as they were when mom and dad inflicted them. So when I became aware that I was shaming myself for something I did or said, I had to remember to respond with that, with my kind and gentle, newly created, caring parent. I would say to myself, you don't have to say that. It's not true. This is just the old habit you developed as a kid because you thought it would please mom and dad. This treatment of myself helped to diminish my self-loathing. Another term they use in ACA is the critical parent. Adult children who suffer from the dysfunctional parenting they received as a child tend to internalize a critical and unloving stance towards themselves, like I did. That's the critical parent. So whenever my critical parent attacked me with scorn or name-calling, I would say to myself, that's the critical parent talking. You don't have to pay attention to him anymore. Gradually, I came to see myself as having a fight in my mind between my critical parent and what I call my caring parent. In ACA, they say loving parent, but I don't like to use the word love because it's so commercial. I see it as a buzzword to get people to spend money on flowers and candy. So I say caring parent instead of loving parent. My critical parent used to attack me several times a day. I could be walking down the street and suddenly become aware that my critical parent has been dissing me for the past several minutes. Then I would bring out the caring parent to drive off the critical parent by contradicting it with kindness. As I practiced reparenting, the frequency and the intensity of the attacks diminished. I've gone from 100 painful attacks a day down to 1 or 2 ineffectual efforts by my critical parent to hurt me. Now my critical parent has been reduced to a puny nuisance, less annoying than a fly. If it tries anything at all, it gets stopped right away and causes me no pain. I go many days without attacks at all. So in my experience, learning to reparent has been like learning to ride a bicycle. At first, it was hard to get started. Once I got it going, I still felt clumsy and unable to control it. But gradually, I developed the skill. Then I began to do it well. Now I've replaced my critical parent with a caring parent of my own making. My feeling of wholeness has increased along the way. I feel a positive regard towards myself. I like myself. I feel a sense of wholeness or completeness in myself. Now I feel comfortable with myself, and I'm glad to be me. Sometimes I feel like Walt Whitman in The Leaves of Grass. Check it out. As I've noted, the practice of reparenting has required me to keep a sustained focus on my inner self, specifically on my wounded inner child and critical parent. By staying in this self-reflective consciousness, I have learned a lot about myself. For example, I've learned that the pain my parents caused me lived within my inner child, until I learned to wash it away by reparenting. I've learned that my parents caused my pain, and my pain caused my anger, and my anger caused me to do the acting out I did, even though I didn't feel any of the pain or anger. As I said, along with the vanishing pain and anger came a growing sense of wholeness. For me, this is a physical feeling in my midsection. It's not like feeling full after a Thanksgiving dinner. It's a much lighter feeling. And now I feel like all my questions about life have been answered. I feel like I've done my job of recovery well. So to sum up this video, I want to say that the practice of reparenting and of working the ACA program from the secular point of view has both increased my feelings of wholeness and opened up new vistas on the possibilities for dwelling in my self-reflective consciousness. I'm beginning to see that reparenting can go beyond just replacing the critical parent with a caring parent. I've learned that there are levels or degrees of intensity to my feeling of wholeness. The intensity increases as I expand my self-reflective consciousness. I don't know how far this can go, but I'm going to keep on working on it. I'll talk more about what I see as the next level of reparenting, or maybe I should say going beyond reparenting, in future videos. For now, I'll close with the secular ACA Serenity affirmation. Today I seek the serenity to accept the people I cannot change, the courage to change the one I can, and the wisdom to know that one is me. Keep coming back. It works if you work it, and you're worth it.